everybody. Josh Rubenstein, the Director of Media here in Southern California, and these are our KP Candid Conversations. And today we are with Dr. William Neal, and Dr. Neal is a vascular neurologist at Kaiser Permanente in San Diego. Dr. Neal, thank you very much for joining us today, and we're going to be talking a little bit about strokes. But I guess I first want to start off with a little bit about you and why you why did you become a doctor, and why did you choose this field in particular?
Yeah, my name's Will. I've been in San Diego with Kaiser for just over 10 years now. I actually became a doctor because I saw a lot of brain injury and family members with strokes. And I just really wanted to learn more about the brain and learn how to cure afflictions of the brain. So I've been dedicating my life ever since to that. For me, the most devastating affliction of the brain is a stroke. What happens with a stroke is you don't get enough blood flowing to the part of your brain that helps you to either talk or to see or to move. And then suddenly you're disabled. It's like night and day. And whatever I can do to make that not happen or to minimize the damage, that's what I want to do.
So I have a couple questions for you. First off, when we talk about strokes, right? I think people are confused on even where a stroke happens. Is it in your heart? Is it in your brain? Is it in your leg? Where does it happen? Where does a stroke happen?
It's a good question because there's a lot of confusion about that. And there's a lot of misunderstanding about it. When you have a heart attack, generally people will feel pain in their chest, like an elephant sitting on your chest. And that's because the heart doesn't get enough blood and it can't pump blood to the rest of the body. And you feel pain. With a stroke, you're not getting enough blood to the brain. When that happens, you don't feel as much pain, but what you feel is difficulty talking or moving your body. So generally a stroke is lack of brain functioning because it's not getting enough blood flow.
How is it different from an aneurysm?
Yeah. Aneurysm is a different kind of problem with blood vessels where the blood vessel becomes weak and the blood vessel can actually burst and cause severe bleeding. We can also get other types of bleeding into the brain. When that happens, people can notice it with sudden severe headache and then other problems, walking, talking, and moving.
Generally, we've seen it on TV, you've seen it in movies that people will get a stroke and they're all tensed and something intense is happening. But I assume it can happen then and it can happen anytime, right? When you're doing nothing.
That's part of the problem. When you compare it to, say, a heart attack, you feel chest pressure like an elephant sitting there. With a stroke, it's more subtle. You don't get all tense. Alarm bells don't necessarily go off. What people generally notice is their foot fell asleep. They're dragging their foot and it's not moving. Their cup of coffee is a little bit heavier and they're dropping cups. They're having trouble understanding words, either reading a text message, watching the television. They can't follow conversations. Maybe all of a sudden somebody will have trouble thinking, concentrating from out of nowhere. So it's a lot more subtle and sometimes hard to recognize. Because it's been really hard to recognize, we actually came up with kind of a clever mnemonic that kind of goes over the different symptoms of stroke. The mnemonic is Be Fast. It's an acronym, BEFAST. And what I tell people is if you or somebody you know, if you notice any difficulty with balance, eyes, face, arm, or speech, time to call 911. If we can treat this right away, we got a better chance of helping make it better.
Can you reverse? So I've got a lot of questions from this.
Sure.
Can you reverse a stroke? Is this something that's curable, or is it something that you're stuck with forever if it happens?
Occasionally, if you can, if somebody is able to notice the symptoms of stroke right away, and if they're able to get to the hospital right away, and they can receive a clot buster blood thinner medicine, or they can get a surgery where they can dig out a blood clot, then people have a chance of actually being cured of their stroke. Even if they're not completely cured, like totally back to normal, people have a much better chance of getting better. The sooner you get to the hospital, the better. Afterwards, even after a stroke, the brain is always trying to heal itself. So I get asked a lot about maybe a couple weeks, maybe a couple months after the stroke, am I going to get better? And I say, look, the brain takes time to heal up. Sometimes you notice you're making a lot of gains, whereas before maybe you couldn't walk, now you're walking. Later on, you're not seeing the gains as much, but your brain is always healing itself. So no matter what, if somebody has had a stroke, it gets better. If it's slow getting better, if it's still interfering with their life, getting back to normal, getting back to seeing their loved ones, getting back to work, there are things we can do to help with that. Different assistive devices, different support within the community, different medications, different procedures. There's things we can do to help.
Is there a magic time between when I start noticing the Be Fast symptoms and getting out to getting that help?
Immediately.
As quick as humanly possible.
I can give you a couple different times. Get here by this time. I can tell your chances of getting better are higher than if you get here later. The bottom line is, as soon as you notice it, if it's happening, or as soon as a friend or a loved one, as soon as you notice it, it doesn't matter. Get to the hospital right away. The sooner the better.
And is there a spectrum of strokes? Because we've heard people say mini strokes, major strokes. Is there, a range of how bad the stroke is?
Absolutely. A stroke can be as mild as feeling tongue-tied, not able to say your friend or your loved one's name. Maybe it's just numbness of your hand. Maybe you're dropping the coffee cup. All the way to as severe as completely paralyzed, unfortunately stuck in a nursing home. Oftentimes, very large strokes can lead to death.
Who is at risk of a stroke? I assume everybody, but who's a higher risk?
Yeah, there are. It can happen to anybody. There are some people at higher risk than others. Typically, the longer we live, the less pliable our blood vessels get and less efficient our heart pumps. And if we don't have a good pump and if we don't have good pipes, as time goes on, the older we get, we're more likely to get a stroke. Other risk factors are high blood pressure or hypertension. What high blood pressure means is actually stiff, narrow arteries. We call it hypertension because that's what we see on the monitor. But what we're really talking about is stiff, narrow arteries. Hypertension is the most important, most treatable risk factor for stroke. If you have high blood pressure, If a doctor recommended you take medications, make sure to take them every day. It's very important because you don't necessarily feel better when you take blood pressure medicines, but I can tell you they will save your life.
Are there certain? Oh, go ahead, please. No, go ahead.
Oh, I got more.
Okay, keep going.
That's the most important risk factor. There are other ones. Diabetes is a major risk factor. Smoking cigarettes is another risk factor. Certain heart conditions, if your heart skips a beat, like atrial fibrillation, that can be a risk factor. And then other big risk factors, just like for heart attacks, is being overweight and having inactive kind of a lifestyle. What happens when we have too much extra weight and cholesterol in our body is that extra weight gets carried around in the blood vessels. It's harder for our heart to pump against it, and we have more narrow arteries, and the blood can't get through to the brain. Best way to help with that is to eat as many fresh fruits and vegetables as you can get your hands on, and to try to do whatever you can that makes you happy to move your body.
So exercise and being physical is critical.
Exercise and being physical is critical. I don't like calling it exercise because whenever I say exercise, people automatically think of a treadmill. And it doesn't necessarily mean the gym or a treadmill or the Zumba class. We can, whatever, the way I look at it, whatever you can do for 30 minutes or more per day, that gets your heart rate up to where you're still able to talk to somebody, but if you try singing, you won't be able to sing. So that can be swimming, running, hiking, even horseback riding, mowing the lawn, all these activities. Move your body, get moving.
So you're talking about a sedentary lifestyle, trying to avoid that part.
Absolutely.
Yeah. Are there certain populations that are more at risk for strokes?
There are. There are different kinds of risks for men and women. With women, they can have higher risk of blood clots related to different hormonal levels in their body. With men, we can see more tobacco use and alcohol.
Do we see a high incidence of stroke in the African American population?
Yeah. So among different race ethnicities, there is a similar amount of strokes. The recognition and access to care can be lower. What can happen in our Latino population is if there's a language barrier, they may not be able to get access to care right away. With African Americans, it's similar. They're at a similar risk, but may not get access to care right away.
We're talking about men and women. Do the symptoms match? I know that there have been. I've heard that a heart attack, maybe some of the symptoms of a heart attack are different in men and women, or are these symptoms equal when it comes to the gender?
For a stroke, it can be equal because of the gender. The difference is with women. They can have stroke more often at a younger age, either with genetic causes or hormonal causes. So that's an important difference is women can be at higher risk at a younger age.
And anything that you say about keeping your heart healthy, is that sort of the same kind of thing you would say about avoiding stroke?
Absolutely, 100%. And it's pretty much line by line. The stuff that you do that's good for the heart is good for the brain.
It's got to make you feel good as a physician when you can get to someone early. I mean, you have to feel that satisfaction. Is that how you feel when you're treating patients you can get to early enough?
It's a matter of life and death. If I can get there early enough, the patient can get there early enough, we can do different things that can save their life. Even if we don't save a life, we can save their livelihood. We can save their well-being. We can save them from being disabled. We can keep them able to walk and talk and get back to work and hug their loved ones. So it's incredibly gratifying.
I love it. Well, thank you very much. Be fast is what we're going to remember from this conversation. Dr. Neil, vascular neurologist at KP in San Diego, Kaiser Permanente in San Diego. Thank you so much for spending some time with us.
It's been a pleasure. Thank you.